HealthBreak is sponsored by Mission Health.
As we age, arthritis in the hip often causes pain and limited motion. When physical therapy and steroid injections no longer help, hip replacement is the best option, according to Dr. Landon Hall from Mission Health.
We do an anterior-based approach, utilize a bikini incision. We are able to go between the muscles rather than through the muscles, how they've done it historically. So it's a pretty remarkable recovery period compared to how they've done historically. Specifically, the first 6 weeks is when we see the biggest change. Long-term, it is a more stable hip, a lower risk of suffering from a dislocation. There's been several studies, people who skied before, bicycled. If you did those things before, you can get back to those activities. Greater than 75% of patients do get back to those activities. In Asheville region, that's important. Most people are active and want to get back to doing outdoor activities.
To learn more, go to missionhealth.org/healthbreak.